If you're into exercise and fitness, you've probably run across this phrase DRA or Diastasis Recti, Diastasis Rectus Abdominis. They all mean the same thing. It's basically a separation of your abdominal muscles that often happens to women during pregnancy. And so today I'm just gonna break down how to assess for one if you think you might have one or if you're just curious if you have one. And then we can talk about all the things that you can do to fix this problem and how it's not really that scary at all. So let's just quickly talk about what this DRA really is. So basically there is a fascia that wraps all the way around all your abdominal muscles, and it connects in the front through what they call the linea alba. And it's basically like a saran wrap, just holds everything in nice and tight. When we moms gain weight and have babies, it just gets pulled and pulled and pulled and often separates in the front during pregnancy. After we have the baby, it's not an automatic that just closes back up. And depending on the amount of weight gain, depending on how quickly the weight was put on, just your genetics, all sorts of things, sometimes this closes and doesn't cause you any trouble at all, but sometimes there remains a gap and it can cause things like incontinence or pelvic pain. And so it kind of is helpful to assess, do I have one? And if I do, what should I do next? Because it seems intimidating, but it's really not. So I'm just gonna show you a quick way to assess it. Let's get into that now. So if you're curious if you have a diastasis recti abdominis or a DRA, this is a position that you wanna check for it in. You're gonna lay somewhere comfortable. You could easily do it on the floor or a bed. I'm doing it on my massage table because that's just what I had available to me. But you wanna lay in a position where your knees are bent, your feet are flat on the floor, your shoulders are just nice and relaxed for now. And I would highly suggest that you get to know what your abdomen feels like and your ab muscles when you're at rest. Kind of work up and down your midline or in line with your belly button. Move your fingers kind of side to side and see, does it feel like there's a gap there when you're just at rest? Can you feel where the abdominal muscles come together? And just kind of get a baseline for what does that feel like. When you're ready to check if that separation exists for you, what you want to do is go to your belly button, go about 2 inches above your belly button, place your fingers at the midline, and lift your head up off of the table until your shoulder blade clears the table, and you're going to feel side to side. Is there a gap there? And how many fingers can I fit in that gap? 2 or 3 or 4? How many fingers fit in there? To do the full assessment, you really should go about 2 inches below the belly button as well. So you go ahead and put your fingers on the midline, lift your shoulders up off the table until your shoulder blade clears it, and feel again, how wide is that gap? How many fingers can you fit in that gap? And that will give you an idea of if the gap is above or below, how significant it is. If you are able to feel more than 2 fingers of gap, it probably means that you do have a diastasis recti. This would be, you want to gauge, like, are there other issues tied to this? Am I having back pain? Am I having incontinence? Do I have pain with sex? Like, what are your other symptoms? And maybe they're related to this gap in your abdominal muscles that hasn't closed yet. Don't let DRA make you scared to move, scared to exercise. It doesn't have to be intimidating. There's lots of conservative treatment that you can get in touch with a women's health physical therapist, and they can give you a lot of guidance on what exercise is good for you, what exercises to avoid for now, how to progress back to your normal activities, and just cosmetically make things look better probably too. So subscribe to my channel if you want to see more videos like this, because I am a mom that wants to journey with you as a mom through pregnancy, postpartum, and beyond. So thanks so much for joining me today, and we'll see you all next time.